evening, everyone. Our most recent WMUR Granite State poll showed that adults in New Hampshire once again considered the drug addiction crisis the most important issue facing the state. Congressman Ginta, you cite your work on a bipartisan task force and your support of the Comprehensive Addiction and Recovery Act as accomplishments in battling this crisis. Can you point to a couple specific examples of how your work has improved the situation?
Thank you very much, John, for the question. First, I am chairman of the Congressional Task Force to combat the heroin and opioid crisis in the country. And I decided to choose Ann Kuster, a Democrat, as my co-chair because we wanted to put people first, not politics. We've got almost 90 members equally divided amongst Republicans and Democrats on that task force. Anytime we want to get something done, we've got an army of 90 people immediately willing to help the crisis of addiction. So the Carroll legislation is the first step, $192 million a year for each of the next 5 years. One of the most important amendments in that legislation is my amendment to provide treatment and recovery services. We only have 12 locations here in the state of New Hampshire for long-term treatment. We need significantly a higher amount. That particular amendment is going to save lives, particularly in New Hampshire. On the security side, I visited the southern border and was able to get additional resources for the Joint Task Force North to make sure that they can stop the heroin coming across the southern border.
And Congresswoman Shea Porter, if you could do just one thing tomorrow to make a difference in this epidemic, what would it be?
Fund what he did not fund, which is the CARA bill. So communities actually have money to put beds in and to expand treatment. Because without money, it's just talk. Congressman Ginta on the Budget Committee voted against increasing opioid funding, and then he voted against the big bill last December that had funding for the opioid crisis, and they authorized the CARA bill, but there's no funding behind it. So that's what I would do. I was very active in Congress starting in 2010 when we realized what the problem it was. We put in several bills. I also was the vice chair of the Addiction Treatment and Recovery Caucus with Patrick Kennedy, and we have worked on this, but I'm delighted, and I give Congressman Ginta credit for bringing people together to work on this, but you have to fund these problems too.
Yeah, Congressman Ginta, respond to this, because in the primary debate you said that the CARE money would be delivered within about a month, I think was your answer. It's been a couple of months now.
So the President of the United States signed the bill into law earlier this summer. It is $192 million a year for each of the next 5 years. The funding mechanism currently, what I said in the primary was it will start in September, and it has. The funding mechanism right now represents funding through December 9th, which is that CR, but it will continue as Congress decides how it's going to continue to fund the government, whether it's a short or long-term budget process. But those dollars will be in each of the next five budgets.
All right, thank you. Back to John DeState.
And Mr. O'Connor, can you name something that has been flat out overlooked in the response to the drug crisis?
Yeah, so what I would propose is we were the epicenter of this crisis, and every day it seems that I meet a family who's lost a loved one or a close friend to this terrible addiction crisis. In 2013, we had less than 200 deaths. This year, we're expected to have almost 500 deaths. So what I've proposed is that since New Hampshire was the epidemic center, we should have a pilot program from the federal government. Right now, we only get 72 cents back on the dollar for every dollar that we send to Washington. I'd like to compress that gap by having a pilot program that would give every Granite Stater who is struggling with addiction 90 days of inpatient care and then 6 to 12 months of rigorous outpatient follow-up. Because in my conversations with healthcare providers and with mental health professionals, as well as with those in recovery themselves, they say that that's what it takes. So many who lose their lives to this epidemic have had 30 days of inpatient treatment, and it's simply not enough. We need a pilot program that starts here in New Hampshire and covers the entire state.
Josh, I'd like to chime in. It's not a 30 or 60-day program that we need. First of all, when somebody is overdosing on heroin, they're going to be brought to a hospital. They're going to be treated, and within several hours, they're going to be released. At that moment, you need a drug coach, a recovery coach, interjecting and working with that individual to get them into a drug recovery court, and then a mandated 18 months of long-term treatment. That is the most successful way of actually trying to help somebody deal with the issue of addiction. And in that circumstance, we've seen the statistical data, 69% of the people who go into that 18-month program actually have do recover.
All right.
If they go into, if they're in jail, it's only a 19%.
Right. Frank knows what I know on this issue. He is correct, and this is the way to address this. But again, you need to have the funding to make all this happen. So
And that's the amendment that I included in CARA, the Treatment and Recovery Amendment, that is critical. That is why New Hampshire is going to get additional
Sure.
facilities.
I just want to point out, as far as the rules of the road is concerned, rebuttals are offered when you're directly attacked. So let's try to keep it there. But please respond to what you just heard. Take 30 seconds, and we got to move forward.
Yeah, I mean, I think that the important thing is that we have a comprehensive plan that is a public-private nonprofit partnership. It's not going to work to simply authorize $150 million. We need to really put the resources in place. We don't have the beds right now in New Hampshire to be able to provide the kind of treatment that everybody agrees that we need. My plan, my pilot program, would create those beds and fund those beds so that we can get the kind of treatment that people desperately need here, because there's no signs of this epidemic slowing up.
All right, Mr. O'Connor, thank you very much.